Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hey, everybody. Welcome to this episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. My name is Jeremy Wynn. I am your host. I'm the Director of Sales here at HCP. I'm really excited today. I've got one of my good friends, a longtime buddy, and he is going to be an amazing guest for you to help talk about some strategies for your business. So we've got Jason Rodgers on today. He is the Chief Revenue Officer for Nexus Contingent Workforce. Also, formerly in a previous life, he was the CEO of a billing company called Premier Health Billing Services and founder of that company. He's had a chance to, since, last couple of years or so, exit that company, and now he's over at Contingent Workforce Services doing some amazing things. So, Jason, thanks for being on and welcome today.
Well, thank you so much, Jeremy. Appreciate it. It's a pleasure to be on and to be able to have this conversation with you today. I'm excited about it.
Awesome. So I think, for a lot of our listeners, a lot of them are clients of HCP, and we're always trying to drive additional value to them. And one of the things we get asked about a lot is in the HR space.
Yep.
We certainly do HR compliance, right? We have policies, procedures. We help with general kind of federal level
Yep.
policies, procedures from an HR perspective. But with your experience at Nexus, I thought it would be really helpful to bring you on and let you talk about really what you do at Nexus and some strategies that can be beneficial for our healthcare clients, as many of them are in growth mode, as they're growing, as maybe they're expanding beyond the state they're in and entering multiple states. I know there's a lot of really cool tools and techniques that you can help with. So I'd love to just start with that today.
Absolutely. There's a lot of different ways that companies can leverage the power of Nexus Contingent Workforce for their organization. First and foremost, we are what's called an employer of record service. So, as an EOR, we actually act as the true employer for a lot of the workforce out there for our clients. And why that's important is with an organization that's growing rapidly, and they're not set up in all the different states across the country, and that stuff takes time and resources, and they're really on the fly. They can utilize the power of Nexus Contingent Workforce to onboard those employees. We onboard them, we pay them through our payroll. They have access to our Fortune 500 benefits, health, vision, dental, 401k. And so it allows organizations to be able to leverage our company to be able to attract top talent, to also be able to expand across the country where they may not have had a presence in the past, and they need to have some kind of compliance and HR presence within that state to be able to expand. That's what we really do well for a lot of our clients. Another thing that we do for clients is when they know that they're going to have a surge of a need, right, and they're going to have a need for staff. Instead of just going with a traditional staffing agency that will help you find the staff and then you employ them, put and onboard them onto your organization. You could really just call Nexus and say, hey, look, we need 10 nurses. We need them, in the next 30 to 60 days. Can you help us find them? We'll say, absolutely. So our team will go ahead and look for them and place those individuals within your organization. They're W-2'd by us. We send you an invoice, and the client pays the invoice. They know that there's probably going to be an end date for some of those workers, and that's very transparent. Some people leverage the power of Nexus Contingent Workforce simply as their front end HR. So think about how many times, as business owners and as leaders of organizations, do we hire somebody after 5 or 6 rounds of interviews, and within the first 45, 60 days, we're like, oh man, I don't know if this person is the right fit,
You
right?
haven't experienced that yet. You just haven't hired enough people. That's really kind of because eventually
It's,
everybody, makes a mistake or
yeah,
just from either side, it just wasn't the right fit. It could be the employer
yeah,
saying this isn't the right fit for, the employee could come and say, man, this is not the opportunity
100%.
that I was expecting. So it's both ways sometimes. Yeah.
It is. It's absolutely both ways. And sometimes, no matter how good our systems are, our processes that we have are in place, there's going to be instances like that. And then at that point, you're already married by the state, right? You have an employer employee relationship, so you're governed by the laws by which those relationships are to be handled. And so, in order for you to mitigate that risk, a lot of companies will utilize us as their front end. So
Yeah.
think about test driving your Ferrari before you buy it, right? So why not? Organizations will say, okay, Nexus, you guys hire them for us for the first 6 months. They still have the benefits package. They still have the 401k. They're
Hmm.
getting payroll regularly on our same schedule.
Yeah.
And then after 6 months, if we feel like it's a good mutual fit, then we can directly hire them on and we'll transfer them over to a direct employee of our company. That solution has been key for so many companies that are growing and scaling, and they just don't want to have that liability,
Yeah.
especially when you don't know somebody in a brand new market. Um, PE firms, they love this
Yeah.
model.
Yeah. One of the questions I was actually going to ask, and so let's just jump into it, is we work with a lot of private equity groups,
Okay.
and their portfolio of companies. A lot of those in those scenarios also are MSO
Yep.
setups where they're acquiring, healthcare practices all over the country. So yeah, let's jump into strategies that you've seen work for those specific setups.
Perfect. Yeah. We work with a lot of private equity firms that acquire organizations, and they're simply looking at the books, right? And then the people, the leadership is important, very, very high up on there. But when it comes to, okay, they're acquiring this new portfolio, and then they have a new company that's based out of California, let's just say, and they're like, "Ooh, California, our appetite to acquire a company in California is not super high, but those books look really good. The business looks solid." Instead of saying, "I'm not going to even touch that," you can easily, and companies have done this, where you acquire the company and immediately put all of those employees on Nexus Contingent Workforce's payroll as the employer of record. So you still own the company, but you still don't have any employees in the state of California.
And you avoid all the additional regulations that we know, California can be famous for, and
Yep,
other states, fill in the
absolutely.
blank state. There's certainly nuances in many states that we see on the compliance side. It's similar in HR, and so they're
No
they're
doubt.
allowed to kind of avoid some of those headaches that they may face.
No doubt. And I mean, it comes to mitigating your risk, right?
Mhm.
California, New York, New Jersey, Massachusetts, some of those states are really tough sometimes when it comes to employee employer law. And so a lot of PE firms will say, let's just acquire companies in all the other states. But sometimes when you're like, man, there's a really good company here and I want to mitigate my risk, you can leverage the power of an EOR company like us. When it comes to MSOs, so I want to get to that point. So
Yeah.
MSOs, right? So they're the management service organization that is really in charge of trying to bring the infrastructure right
Yeah.
to these medical groups. And when a group or a practice group is joining an MSO, they're going to ask, why should I join the MSO? What are they going to offer me? What's attractive to that to me? You know, what's attracting me to join this MSO?
Hmm.
And an MSO can certainly create their own in-house HR departments and create broker relationships to be able to offer benefits and do the payroll and all those things. But when you're talking on a regional, and then start to get into a national type level, where you have multiple employees, you can really leverage an EOR company like Nexus to come in and say, hey, look, why don't you put a portion of your MSO on Nexus? If we want to attract them, they're moving maybe from a health system model, and your MSO right now is not set up to attract really top talent. You can still attract them, just put them on Nexus, and we can give them the Fortune 500 benefits they're looking for, that they're used to, the 401k, that comfy, golden handcuff, so to speak, right? That they're used to having. But probably bad analogy as a handcuff, but you know what I'm saying. Um,
Absolutely.
it's those benefits that people really have come to appreciate. And if you're an MSO that doesn't have those, you can still leverage the power of Nexus to be able to offer that.
There's lots of, that also similar model. I mean, it's the same scenario when you've got a startup of a new healthcare practice. I think about med spas because that's maybe, the one where we're seeing more and more entrepreneurs come in and they're starting up, spinning off these med spas. And so the ability to stay competitive with the C-suite, right, as you're trying to make hires, as you're
Yep.
building out your executive team, and that's a huge strategy and a huge advantage to be able to offer them those types of benefits, even at your startup stage. Um,
100%. Your one or two man team before, when when companies were starting, they just didn't have the ability to be
right.
able to offer that kind of thing because they didn't have that robust infrastructure. Now you do. I mean, we service one or two man teams all the way up to organizations that have tens of thousands of employees.
Yeah.
And we have a dedicated account manager that can help onboarding. We act as the third party HR, sending the offer letters all the way through the whole process, helping them enroll in their benefits. So it's really like having your HR sidekick, so to speak. When you're starting out, you're like, HR, it's a cost center. It just
It
is.
is big time.
Some people will try and say, oh, it's not, like, it's a cost center, right? But if you leverage your cost center through a third party that is doing this all day long, and that can help you to attract the top talent that you're looking for, and then give your team the benefits and the security that it needs, also by mitigating the risk in certain markets and situations, like, what more could you really ask for?
I love it. Okay. Any other topics that you think would be, worth talking about while we have you on today?
Yeah, no, I mean, I feel like healthcare, right? Compliance is always top of mind, or at least should be for healthcare practices. And we talked about it earlier, when it comes to compliance, HR compliance is right up there. Some of the biggest risks that a private practice has, or any medical practice has, is the malpractice of a oh, I did something on accident to a patient, right? That is a risk. Risking the billing side is a risk, and then also the employee, the workers, those are risks. So if you mitigate those three areas within a practice, and you're doing, you're blocking and tackling on each side, I think, um, you know, you've got a good operation.
Jason, this has been awesome and really valuable. I think those that are listening, especially those that are clients of HCP, find a lot of value. How can they get a hold of you if they want to learn more about Nexus and talk about maybe some strategies for their business?
Yeah, that's great. You can go to our website, nexuscw.com, fill out a form. You can reach me directly at jason@nexuscw.com. And we're always happy to answer questions. We love, strategic conversations. We have a lot of long-term clients that started out as, 1 to 10 man teams and turned into companies that are employing thousands of people. So we're really excited to continue to help, um, companies, and we're here to answer those questions for them when they're ready.
Jason, as always, so good to see you, my friend, and great to have you on today.
Thanks, Jeremy. Appreciate it.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.